Hi, welcome back to my YouTube channel. I'm Dr. Lila Abbate and I'm a physical therapist. Today I'm going to be discussing testicular pain. Testicular pain can originate in several different ways, and today I'm going to be discussing 3 of them. So a lot of times the first thing that, as an orthopedic physical therapist, what I should be thinking of is the spine. Well, you'll see in one of the close-up photos that there are nerves that come at the back of in the front of the spine that will go down and come through the inguinal canal and then come into the pelvis, and that is what innervates the scrotal sac itself. There can be deep pelvic floor muscles that seem to be the causation. There are potential inguinal compression, that there can be compression at this area, as well as maybe potentially a hernia. So all of our patients who come to physical therapy are always medically cleared by a physician to make sure that there's no pathology or disease that's actually causing some of these symptoms. So we wanted to make sure that you're being seen by a urologist and they're doing their medical screening. Once that is all cleared and then you come into physical therapy, we're looking at these different potential compression sites that can be a causation. So like I mentioned, there's a ligament that's here, but the nerves traverse this way down into the pelvis. And the nerves can come higher up, anywhere from T10 to L1. There can be rotations within these bones that create some compression at the nerve. And it doesn't have to be due to a disc. It can just be that the bones are rotated. So at all the areas of compression or change within the bone can be C7, T1, T12, L1, L5, S1, those are transitional, where the bones change shape, and that's sometimes where there's a lot of area of impingement or rotation. So we're assessing that, and we're seeing if that's an area that seems to be starting the whole problem to begin with. The psoas is a muscle that's in the front of the bones that goes through the pelvis, and the lumbar plexus can sit on top of those muscles, and then we're releasing and treating them. And that can be also a reason for pelvic floor compression. When we're assessing the pelvic floor musculature, for the men we're assessing it rectally with gloves, checking if their muscles, if they're too tight or too loose. And then those areas can create compression along the nerves, and or maybe if they're too loose, tension on the nerves. So that's what we're assessing. So there's several ways to treat men who have testicular pain, and then these are some of the ways that a musculoskeletal physical therapist looks at it. Thanks for stopping by. See you soon.